you have been talking about two things. One thing is fundamental research. The other one is Megha, which rightly pointed out, and you also, about the transparency and also not harm to the society. And Megha was pointing out to make sure that whatever technology comes out is also useful to the society and society can use it. So we can take that way forward. Could each of you can spend some time going a bit into what exactly your focus of research is, what you are working on? Of course, you can keep this one a little bit scientific because the public can understand, but also it's important for the other researchers also to see where you are working on. So if they have an interest to join hands with you as well. So please.
Sure. Avishek, do you want to start?
Okay, I could start. So, so my focus is building intelligent and transparent systems for applications which involves finding relevant information. So think of this as think of this as search systems, right? So information retrieval or the science of search. You would want to you want to find relevant information given intent. So for example, if you have a long intent in your mind, you kind of distill this with 2 or 3 keywords and ask Google, right? So that's your usual search engine. But a lot of things go under the hood, which gives you these results such that you basically get in a single page already like 2 or 3 most important results, right? In 99% of the cases, you do not even have to go to the second page, right? So the science which actually, or the machine learning which goes on inside kind of giving you very important and relevant results already in the first, few pages, right? Is what I kind of deal with, right? So it has a lot of engineering problems, it has a lot of scientific problems and so forth. Now, having said this, there are important issues which you have to kind of deal with in terms of transparency here, right? What could happen is you might kind of promote certain biases, right? Because what you're doing is machine is basically a dumb system, right? It's just learning from whatever training data you give, right? That's the basis of machine learning, right? You get the data, and if your data actually is biased, right, you might actually learn all these biases. Or maybe the data is not so biased, but your machine only knows to kind of connect 1 and 1 and make it 2, right? It might kind of pick up wrong correlations. Okay. So what is actually required is not to make machines which are kind of giving you good performance in terms of whatever your success factor is, but also to make decisions which are according to humans more acceptable, right? So for example, if I give you the image of a horse, a human basically says there is a horse in this one because it looks at the features of the horse, right? It looks at there is a mane on top, there is a tail or whatever, right? It looks like a horse. But if the machine thinks that this image contains a horse because there is some text on the bottom saying that it's a horse, right? So it's making the correct decision, but it is doing this for the wrong reasons, right? So you would essentially want to build machines which are doing right, but also for the right reasons. And that's a hard problem to solve, right? Right now, I'm working on this area of machine learning called interpretable machine learning or explainable machine learning, which focuses on not only coming up with systems or models which are kind of doing well, right, giving good results, but also doing correct, but for the right reasons, and that's kind of the area which I'm focusing on. So that's called the explainable machine learning. Right? So I wear other hats, but that's the most one of the current focus.
Right. So for a very layman like me, so you are making my life, or like me, many people, as soon as I give in Google, Yahoo, or whatnot, then within a second on the top 2, I get the closest match that I wanted to have.
Yes, I will give you very good results, but when you want to ask like, why is this document ranked higher or above the second one, I should be able to give you also an explanation, and this explanation is something which should agree with what humans think is acceptable, right?
So it also has to do with, it's not about just because that or this company is paying money, so it's ranked top, or for
It
non-ethical
could be
reasons
that.
or something.
It could be also that, right? It could be also that this is a sponsored link, right? That's why I rank you higher. But then the responsibility is onto the user, right?
Hmm.
To which one to click now, right? So
Right.
it's just that you're making a system transparent. Of course, like search engines don't use these things, right? But now with GDPR and everything, you search engines and all the other companies are interested in this also, because maybe if a legal auditor comes in, right, and they have to produce a reason, right, why was this one more, why are you favoring one company instead of the other? You should have a reason for this
Right. We will get back to that a little bit more in detail. Megha, please.
Yes. So I work on developing procedures or algorithms to learn from complex data. And what does this complex data mean is it could be let's say a social network data, right? So you have a Facebook graph where your vertices are the members of Facebook are the people who have Facebook accounts or the users of Facebook, and the links are their friendships, right? So and you would like to learn something from some such network data, for example, who could be friends, right? So what could I recommend you? Who could be your friend? Or let's say in certain product graphs, what product you might like, right? So for example, if you see on Amazon, and then there is a list of products which come in, maybe you might also like these and these products. So this list is kind of inferred from a kind of a complex structured data, or a network of users and the products they already liked. And a second example of this complex data is this medical data, and I think
Hmm.
which is important for each one
Right.
of us. And there we like to use data of all forms, be clinical data or genomics data, or this quantities of proteins in your body, which is called proteomic data. So these are different kinds of data in medicine, and they also do have certain kinds of networks. And the main question which we want to answer to a patient is, so a patient always has this question: why did I get this disease? What did I
Mm.
do wrong to get this disease? Right? So it could happen that two people, or let's say in this corona times, two people having the same symptoms to start with, one of the person gets really sick and the other person gets well soon. And
Mm.
what we are trying to do is, we want to collect as much, we want to learn from as much data as possible, such that we could, so if this healthy person, from this healthy person, if we could find out what was right there, what kind of information can we get from there to help this diseased person who might die soon, to
Mm.
help her or him or her to get better, right? So these are the kind of questions that we would like to answer. Why does a disease take a certain trajectory in certain patients but not in other patients? Why do you
Yeah.
get this disease? So even in the same family, when we have the same almost similar genetic structure, why does one person is get sick? Why does one person get tuberculosis and the other person did not get the tuberculosis when they were sitting in the same room?
In
Right? So
same room. Mm.
why do these viruses target different person differently? What are the differences between these individuals, which can if we know that, we could solve this puzzle of the disease, and we could target our medicines based on this information that we might be able to learn from these different kinds of data, which we call, let's say, medical data, but which consists of a huge variety of data. It could be your lifestyle information, it could be the kind of medicine you took and what reaction did it do, it could be your genetic structure, and also the post genomic data, which comes from this, which comes after several biological processes in your body, and this data is kind of a signature for the state of your body at that point of time.
Yeah, so I think it's very interesting, but if I can relate it to it now, because there is a huge discussion going not only within India, but also outside India, including Germany. I recently saw an article in German newspaper. They said a commentator was writing. He said that he would like to live like Indian system because in India the mortality rate is extremely low. At least that's what reported, extremely low due to during Corona times, and also many of them are not having symptoms. Also, again, the question which you are actually doing research on, which you said, if you are two people in the same room and one is getting tuberculosis, for example, the other with the same family and not the case.